Thank you, Kathy. I'm delighted to have the opportunity to be here with you today to talk to you about some of the trends that we're seeing in the world of community health improvement. For those of you who may not have been on a webinar before with Strategy Solutions, the mission of our company is to create healthy communities. And for the past almost 20 years, we've been working with private sector corporations, community and government organizations, and social services organizations, including healthcare, helping to do planning, project management, organizational development, and program development and evaluation services to help organizations create healthy communities. Our objective today is to talk about some of the new and emerging strategies that hospitals and health systems and other community organizations are using to achieve their community's highest potential for health, presented at this year's Association for Community Health Improvement Conference in Denver. And we're going to talk a little bit about the areas that community health practitioners continue to struggle with, because we heard about that in terms of feedback. And so after we talk a little bit about some of these new and emerging trends, I'm going to talk a little bit and provide some education on some strategies to help you connect the dots between initiatives that may already be underway and some capacity building for more robust outcomes and impact. And then at the end, I actually have some slides, even though I'm not going to be reviewing them all completely, about some methods to improve your outcomes and impact measurement and evaluation process. And everyone who is on this webinar today will get a copy of all of these slides, as well as the resource materials that are part of the slides. So I'm opening today with this quote that Ben Miller actually had in his presentation on integrating physical and behavioral health, because I think this is just a great statement from James Baldwin. Those who say it can't be done are usually interrupted by others doing it. And I think that's really a testimony to what's happening in population health and in community health in various places across the country. Now, I had the honor of being involved in this year's planning committee for the national conference. And it's actually a very interesting process to be involved in watching a national conference come together, because what happens is any number of forward-thinking people that are members of an association actually say, yeah, I want to help make things interesting and better. And the process also will often sort of take on a theme that relates to the area of the region. So if you look at this year's conference was in Denver, it was all about elevating impact together. So the various threads or the tracks at the national conference actually all had to do with something related to elevation, because Denver being the mile-high city. So these were the conference tracks: climbing together throughout community, improving health through collaboration, moving upstream and looking at prevention, resilience, and social determinants. The third track was Place Matters, and it was all about the geographic location and the impact on health. The fourth track was about technology to support population health. The fifth track was around the business case for population and community health. There was, of course, a track on measurement and evaluation, and then one on strengthening the community. And as I looked at those various tracks and the different presentations that were done and what the keynote speakers had, I came away with, and Kathy and I talked about, what were the new and emerging models that we saw at the conference. And these are pretty much the four that we saw really explored. Adopting an anchor mission, the role of a financial manager in a community, the hub and spoke model to treat addiction, and then integrating physical and behavioral health. Now, while these new and emerging models were explored, and there were lots of great presentations on different kind of projects that people were doing, so I can't speak enough about the commercial to get involved with the association, because there's lots of great information and tips and tricks to be learned by being involved. Many people are still struggling with the basics. How to align prevention, wellness, population health, and community health improvement strategies, and herd cats and connect the dots if they're involved in a health system, or to integrate those efforts across a community if they're from a health department or a community-based organization. How to implement evidence-based programs and justify that investment, and then how to measure and evaluate outcomes and impact. People continue to struggle with that. But if I look at the 4 things that were kind of new takeaways, I want to spend some time sharing with you some of the takeaways and getting the resources in your hands. Those of you who are listening to this presentation, you will get not only a copy of these slides, but also get a copy of these resources that each of the speakers spoke about. Now, this concept of adopting an anchor mission is actually based on this report by Tyler Norris and Ted Howard from the Democracy Collaborative. And the presentation itself was actually from Rush Health System in Chicago, talking about the various things that they were dealing with and what it really meant for the health system to invest in the community because of the disparities that they saw. And the idea was, and the idea is, for a hospital to think about its anchor mission as part of the economic fabric of the community, not just providing healthcare services or what it can do in terms of prevention and wellness, but what are the things that a healthcare system can do to address the health inequities and the social and economic inequities. And one of the things that I thought was really interesting about the Rush Hospital presentation is that one of the pieces of analysis that they did in the presentation was really looking at how place matters and the different types of inequity that was present in the community based on what they described as an urban hardship index. And that idea, I've not really seen that construct much in the Healthy Communities literature or in Healthy Communities projects, but Chicago Rush Hospital Health System actually made it part of their community health assessment and actually and calculated the index based on the proposed methodology for urban hardship, and really helped to look at the disparities that existed in their hospital service area and in their community. And so it's just a great construct that you might want to consider enhancing your own local community health needs assessment with, because, while this slide is a very simple example of the difference in life expectancy, that urban hardship index actually calculates sort of a blended rate based on a number of things like unemployment and poverty and other aspects of hardship that gives a little bit of a different perspective than just life expectancy, while that's an important indicator. And the thought process here is that what counts is not just the hospital system or the healthcare system ensuring access and supporting community organizations and providing education and prevention activities, but they should be leveraging their assets to do things in the community that help make a difference on the social, ecological, and economic footprint and its impact on community health. And one of the strategies, for example, that came out of Rush Hospital's analysis of this is that they were going to focus on buying local when they purchased goods and services in the community, which I think is absolutely a great strategy to foster local economic improvement. And I do know that here in Erie, Pennsylvania, one of the local hospitals has actually established a partnership with neighborhood organizations in the community directly surrounding the healthcare system to help create a pipeline of young adults to get involved in training programs that would help them enter various occupations in the healthcare system in a way that they wouldn't have otherwise access to. So the healthcare system is creating an opportunity to make an impact on the local economy by employing people and doing job skill development for people who wouldn't otherwise be able to have healthcare careers or get on a career path, and they're employing people who were otherwise living in poverty in their local community. So it's just great win-win scenarios that every health system should be looking at how to really think about what's its anchor strategy in a community. The second model that I thought was really interesting when we were looking at what was new in the world of community health improvement is this concept that comes out of a report that was published by the Trust for America's Health on a blueprint for a healthier America and sustaining community health efforts by creating a role in a community, an intermediary role called a financial manager, which I think is a really cool thing. And the presentation in this particular report talks about the fact that communities should have a financial manager, whether or not it has what's called a backbone organization or a organization that coordinates any type of community health improvement effort or intervention. Social impact or collective impact literature suggests that communities that really want to do a lot of collaborative work to impact a community in a positive way ought to have a backbone organization or a coordinator that helps keep those collaborative efforts moving and that provides some project management support. But the financial manager role can happen with or without a backbone organization, so it's not dependent on that. But the cool concept of this is that you take dollars from different funding streams or from different grant opportunities and you sort of leverage it together. So by having somebody in that financial manager role that helps with the coordination and the raising of money and the leveraging of funds really helps promote investment in the right kinds of priorities for a community. And I heard that and saw that information and said, gee, this is something that more communities ought to really be thinking about in terms of how to really advance some of the forward-thinking efforts in their community. So it goes beyond what a community development corporation does or a neighborhood development corporation and really helps to leverage resources for a variety of different projects. The third item that came up that we were thinking is like really cool is this hub and spoke model that is happening in the state of Vermont to treat addiction. And through the development of the Care Alliance for Opiate Addiction, the Departments of Health and of Vermont Health Access are really making progress toward integrating addiction treatment with the physical health system. So this is one way of integrating physical health with addictions treatment, but it's the model of it is instead of just putting folks in addictions treatment and then expecting them to, have some type of intervention and then, kind of follow up after, say a rehab stint, for example. This process provides for kind of wraparound services around individuals with new medication therapies in an integrated way through physicians' offices. So it's a very different methodology of really helping in a holistic way to help folks that have addictions actually address some of the other issues that are going on in their lives and not just, sort of give them a replacement for heroin and, okay, figure out how to make your life better. So they've had some great outcomes in, what they're doing there in Vermont is really worth thinking about and expanding. The fourth area that we thought was really exciting is a project that was presented by Ben Miller from the Farley Health Policy Center about making a case for integrating behavioral health and primary care. And his presentation really spoke to thinking about having a global payment scheme and really changing the mindset of, we all have to have productivity within fee-for-service, both on the behavioral health side as well as on the primary care side. But we should really be thinking about rethinking the care delivery system. And the case, I love this infographic here because so many people have behavioral health problems and providers really get frustrated with trying to help their patients get access to the system. There's really a better model. And this actually came out of one of the slides from that presentation. And I do have the permission of the speaker to actually share the information that he sent us even after the conference to anyone that we're working with or our clients or contacts that might be interested in replicating these models, because the Farley Health Policy Center was actually created to help foster this kind of thinking in other states across the country, because Colorado has been so successful with some of their outcomes. And it's just really interesting to take a traditional sort of separate approach to behavioral health and primary care and really integrate it at the point of primary care through a shared team model. And their outcomes have been astounding. And it really is, making sure that the practice, the primary care practice actually follows a plan of care that is really looking at the individual's mental health and well-being as well as their physical health. And what they found is that it can both improve outcomes as well as lower costs. So that model really has some real potential. And the integration model is really based around that global payment scheme so that providers aren't trapped in a workflow designed to maximize volume, as I said, but the primary care practices can then own their own behavioral health resources and really help patients not only do chronic disease management, but also think about how patients are engaged in their care and addressing issues like anxiety, depression, substance abuse, and the impact of those things on overall health outcomes. So that's just a very cool model. So even though we have all these sort of really interesting emerging practices where some groups are doing just amazing things, what we're still struggling with is how to align prevention, wellness, population health, and community health strategies. And one of the resources that we'll send you after the webinar is a really cool report that was published by the American Hospital Association that separates this thinking. I have the citation on the next slide, that really separates what the AHA was calling first-generation strategies from second-generation strategies, because some hospitals or health systems or community partners are a little further along and doing collaborating and really trying to impact the socioeconomics of a region because they realize the impact on health, but many people are still struggling with these issues. And I included for you in the slide deck these basic definitions, because what we've seen is that some people are even struggling with the definitions of community health, population health, and population health management. And this resource from the American Hospital Association called The Next Generation of Community Health actually defines them very succinctly in the three different buckets. And what we found is that, if you're looking at addressing the basics, we're really encouraging folks to just align their needs assessment with their population health and the value-based initiatives in their organizations, which often doesn't happen. Sometimes healthcare systems are quite siloed in their approach, and quality exists in its own island, and patient engagement is its own island, and health, different kinds of collaboration and working with the public health department in a region often ends up being projects that we do, but we don't necessarily put them all together and think about them in a holistic way. And I designed this slide with this sort of Maslow's hierarchy of needs pyramid to help people recognize where they are in the community health improvement evolution. And we labeled the first generation strategies and the second generation strategies because we've said for a long time, as people do community health improvement activities, the longer they do it and the more sophisticated they get in their thinking, they start sort of moving in an upward direction. So as we shift to more value-based thinking, we really start to recognize that collaborative interventions to impact the status of the broader community become important, and collaboration and public policy things are important. So, where are you? This is a good question to ask. Where are you in your organization in this community health improvement evolution? Are you doing things just because you have to, or are you really trying to influence some type of collective impact in a community? And I added this slide into the slide deck because it's a great example of the importance of a multi-level approach to a particular condition, a health condition like weight or obesity, and what the various strategies can do at various levels to really make a difference. And this actually comes from Penn Medicine, Lancaster General Health, which is a hospital system that has been doing things in their community on all 5 of these levels for quite a long time and have a pretty robust implementation strategy to address different types of things programmatically, and over time have started to really make a difference in the health status of the community. Beyond really thinking about where are you in the community health evolution, you want to really start asking yourself the right questions and really looking at where are you in your measurement and evaluation process. And these questions are offered to help you really think through how do you build your internal capacity for improving the measurement and evaluation process, which is what a lot of organizations continue to struggle with. What are you trying to accomplish? How important is collective impact? How important is population health, and how does that tie? To what extent are we trying to address the social determinants of health beyond just doing prevention and education programs? Are we trying to capture all of our community benefit investments? Because what we found with a lot of our clients, that they may be really working hard on implementing strategies to make a difference in the community, but they're not really counting all the work that they're doing. So they have no idea that what their community benefit really is in terms of investment as well as impact. And then how important, are we really focusing on our mission and our mission-related activities or our core values, and what difference is that making in its outcome? And I love this. I love the magic 8 ball as an evaluation strategy. But if we want to improve our evaluation capability, here's some strategies. Identify the current conditions you want to change. Develop logic models. The extra slides that we have at the end of this presentation that you'll get kind of walks you through how to develop a logic model, how to really think through, and gives you some examples of that. And if anyone who's listening to this webinar or the recording would like more specific information on the logic model development process itself, we do offer specific training on those very granular activities if your organization needs help with that. Identify outcomes and impact measures and tools, talk to IT professionals, implement an evaluation progress, and develop a progress report. we tell clients all the time, you should just try to collect the data that you have. Give people sort of a practice run through. Don't wait till the end of the year until you have to do a report. Discuss and document what's working and not working kind of in the midterm. And then really think about, what are you really trying to accomplish, both overall and with your outcomes measurement strategy. Because, developing a logic model, these are the questions that you should be asking yourself if you really want to develop a logic model and find out what the outcomes are. As we've gone through the logic model development activities with many clients, what we find is if you really start talking about, well, what are you trying to accomplish, and you start filling out the different boxes on a logic model, oftentimes we want an outcome that we have no activity to actually do to get us to the outcome. So it really helps you look at the activities that you do and the methods that you provide and say, is the things that I'm doing really going to get us the outcome we want? And then do we have a way of proving that we actually achieved something based on what our involvement was? And these questions will help you answer it. One of the other strategies to really help you improve your data collection process is to hardwire your data collection. And I've said for a long time that the IT folks are your friends. You want to talk to your IT colleagues and ask, does the outcome data already exist somewhere in our system? Because there's lots of data being collected for accreditation or quality or meaningful use that are actually outcomes indicators for our intervention strategies. And if the data doesn't already exist, how do we create a process to get it? And it could be as simple as adding a few data fields or transitioning with a text field in the nurse's notes to a drop-down menu. There's a lot of ways that you can actually hardwire your data collection without investing in new software. And if you want to improve your evaluation capability, the best thing that you can do is to identify a steering committee or a work group if one doesn't exist, a group of people who will actually be your internal evaluators. Identify people that you want to gather information from. The people involved in the program actually implementing it, whether they're clinicians or teachers or educators, they have a good idea of how people are doing within a program. Develop surveys or tools to gather the input. Then get the data all together in one place. And many healthcare practitioners do evaluations all the time. They're always looking at how they improve the quality of what they're doing. They just don't call it an evaluation. What we suggest is that you actually document what you talked about. Document the conclusions from the data review and input. That document becomes your evaluation. And then identify ideas and an action plan to improve your program. We all know how to do this. Sometimes we get scared by the word evaluation. Here's a simple evaluation process schedule that we recommend over the 3 or 4 months at the end of a fiscal year, that you identify the programs and establish a process to collect the data throughout the program. A month after the fiscal year end, compile all the data together, finalize and schedule any evaluations meetings you want to have, distribute data analysis to stakeholders, gather feedback and input. What did the data tell them? What ideas do they have? And then convene your project team to review the data, the input that you got, and draw conclusions. And then prepare any statements regarding your outcomes and impact that you might want to include with your 990. If you're a hospital system, you've got to send in your tax return every year and talk about your efforts to measure and evaluate the outcomes and impact of your needs assessment strategies. This is a good schedule to follow. And then finally, if you want to keep up on the emerging trends and what is making news, we recommend watching for new reports from the American Hospital Association website. They actually have a lot of information on what's new and what's trending. And then I always put in a commercial for become a member of the ACHI. and attend the next conference in Atlanta, Georgia, because there's lots of new information that's shared, and there's really good, helpful processes about how you can improve the things that you're doing. And regardless of where you're at, don't beat yourself up, because we're all on the journey of the process of becoming. Take one step at a time, update your action plan, and try to raise the bar a little bit and make your practice better in what you're doing in your particular organization. So with that, I'll open it up for any questions and discussion that we might have.
Thank you so much, Debbie. This is Kathy. We did have a couple questions come over the chat feature. One of the questions was, do you know what the plans are for the next year's ACHI conference regarding the topics or trends that will be featured as breakout sessions? And will they include expanding on the 4 areas that were discussed today?
Well, as I'm on the planning committee again this year, I do have a little bit of an inside track on what they're talking about, pun intended. The theme of this year's conference, which is going to be held in Atlanta in March of 2018, is Be the Bridge. And the reason why the conference team came up with that theme is because of the bridge that recently collapsed. One of the, I think it was wasn't I-81, one of the big interstates, a huge bridge collapsed not too long ago, and they were working on getting that bridge up and operational again in something like a 2 or 3 month period, which was like, how could people do that fast? But that was the theme that was chosen, and the conference tracks actually do include technology and systems support population health. There's going to be a whole track around these anchor strategies that, Rush Hospital, I think, was the only one that presented on that this year. But enough people who were on the planning committee were really excited about that presentation and what it talked about, that there's going to be a whole theme around that. There, of course, will be a theme around data measurement and evaluation. There will be a theme around the place-based strategies and community development, and really looking at social determinants of health. Then social determinants of health is actually a separate topic area on its own. And on health, the last 2 tracks are going to be on policy and advocacy, which is really going to focus on local, regional, state, national affordability and coverage, which is kind of exciting. And then health system transformation, institutionalizing population health, culture change, the workforce, linking quality with population health. That's also kind of an exciting track from my perspective. So I think there'll be lots of new and good things to hear about and learn at the conference next year.
Thank you, Debbie. Another question that came through the chat was, with the new administration wanting to revamp the Affordable Care Act, do you believe that the IRS will continue the China requirements?
I'm chuckling as I'm here listening to you ask about that. Bruce Lockwood and I, Bruce from PRC, and I did a webinar. Kathy, do you remember when it was? It was like in April or something.
It was right after the ACHI conference. I think we called it Population Health is Here to Stay, even if the ACA goes away.
The Accountable Care Act goes away, yeah. And while the Accountable Care Act as we know it, various parts could go away, and Bruce and I talked about it in detail in that particular webinar. We don't expect the CHNA requirements to go away anytime soon for a whole variety of reasons. One is that the Internal Revenue Service is really looking at the profitability of some of the large, very profitable health systems and saying, what is the community benefit that these organizations that are making millions of dollars, what benefit are they providing in a local community to prove that they're a charitable organization? So a lot of that thinking is really being driven by tax-exempt status of hospitals. So that we don't expect that to go away. We also don't expect the value-based purchasing and the what I'll call the more holistic approach to looking at social determinants and making good decisions about investments in population health strategies. We don't see that going away either, because the whole value-based purchasing component of the ACA will likely be reinstituted shortly after it gets repealed, if that component of ACA does go away.
Thank you. And then the final question that just came through the chat was, what do you recommend as a starting point to begin evaluating our outcomes measurements and successful strategies? I know you touched on it, but do you have any more concrete examples of maybe a successful strategy to try and herd our cats?
Oh, brother. I think the first place to start is to really think about who are the individuals in your organization or who've been involved in your implementation strategies that have a stake in the programs themselves, and get a cross-section of folks that get together to really look at, what are we doing, why are we doing it, and really start that informal evaluation process. Gather the data that you have and actually make part of your action plan to create better data. A lot of times we don't put the investment in data collection that we put into a program, where the evaluation process often ought to have as much of an investment as the program itself, so that you can prove the outcomes. But we sort of shortcut that process. So I encourage people to make the data collection process an objective, so that you improve that as well while you're working on your other implementation strategies.